all these experts sitting at the table here. We want to make the phones ring because you can get free health information this morning, and we're specifically talking, as Mary said, about breast cancer and, of course, the importance of getting mammograms. So right now I have Dr. Mark Jensen here from Utah Valley Regional Hospital. You're also at American Fork Hospital,
correct,
right? And we want to talk about, I guess, life after breast cancer, particularly the surgery, right?
Yes.
Okay, so what happens?
Well, generally we'll do a mastectomy for cancer or for prophylaxis. And right after surgery at the same time, I'll come into the room after the general surgeon and reconstruct the patient, usually with a tissue expander. And then we'll expand the tissue expander, and then we'll exchange that for an implant later.
And this actually can maybe be devastating, but what you do is actually make life a lot better, right?
Well, I like my job because I get to reconstruct the patient and make life better.
And a lot of attention was drawn to this with Angelina Jolie, right?
Well, Angelina Jolie had a condition where she had a genetic predisposition to cancer. And so instead of developing cancer, she had a prophylactic mastectomy, which is becoming a popular choice for women.
Okay, and I guess the screening part of it, especially when you're talking about genetic, what can be done with that?
Yeah, so if you have a genetic predisposition towards cancer, that would be if you have a strong family history, or if you have one of the genetic defects, or if you've had radiation as a child for lymphoma or something, you're at high risk for developing cancer. And instead of developing cancer, one thing that women can choose to do is remove the breast before they develop cancer, and they can avoid chemotherapy and radiation. And it's about 95% effective.
Yeah, and it's also important to point out that any woman can get breast cancer, it's just not necessarily a genetic.
Most breast cancers are non-genetic.
Right.
But if you do have a genetic predisposition, it may be something you might want to think about.
Okay, so thanks so much for being here, Doctor. We appreciate that. Now, here's the number you can call, and we're going to be here through the 6 o'clock news tonight, 877-908-0680. And I think probably most everyone has had their lives impacted one way or another by cancer.